Hi, thank you for clicking on this link to watch my video. My name is Jazz and I'm sharing with you my journey through breast cancer. My journey started back in September last year, 2020, and we are now in the middle of July 2021. So if you have watched previous videos, you will know that I have been through my chemotherapy and I have now also had my breast surgery. In my last video, I had shared with everybody my story around my breast cancer surgery, what actually happened, and also the results from that surgery, which were great news. So after the surgery, I really wanted to share with you a little bit of information about radiotherapy. So on my last video, I shared that I had 19 sessions planned for radiotherapy, which did shock me at first, but it was fine. It was fine. But it does mean I was literally in the hospital every day other than weekends. So Monday to Friday, I would be in the hospital going for my radiotherapy sessions. So before radiotherapy, what they actually did was they called me into the hospital for a CT scan. They then put me in a position, so both my arms had to be up in the air, but the area where they were going to mark the focus on for radiotherapy, that arm was slightly lower. So I'd have one arm up and one arm slightly lower, but they were both back. And in my previous video, I shared how much I was really struggling with the arm after the surgery. But through physiotherapy, through exercises, I have managed now to get a lot more movement in my arm. So they couldn't start the radiotherapy until I had a little bit more flexibility in my arm. So once I was able to hold my arm up and to hold it there for at least 15 minutes, that's when they decided, okay, yes, she's ready to do radiotherapy. So in that CT scan that they first invited me to, they put me in that position, they took some scans, and they also did 3 little tattoo dots on me, one this side, one in the middle, and then one on the right side. And that's to make sure that every time I was called in for radiotherapy, the scan was positioned in a specific area so that they could target that specific area every time they did the radiotherapy. So it didn't hurt at all. It literally only a dot. It's almost like a beauty spot, to be honest. So once that was done, that was fine. They then just called me in for my everyday scans. So I'd usually go in the morning, and my first session took a little bit longer because they had to get me in the right position. But mainly, once they had me in the right position, the radiotherapy itself took minutes to do. So every day I was in, the only side effects I really got from radiotherapy was I had a little bit of a rash. I had these tiny little red dots. They were a little bit itchy, but not too bad. And then also my skin had darkened quite a lot. So all they actually recommended and suggested is that I moisturize every day. Which I'm really glad I was, and I'm glad I followed their guidance, because after the radiotherapy finished, I think the colour faded, the darkness of the skin had just changed back to normal. So I was really glad that happened, because it was a little bit strange to look at. So after the 19 sessions, should I say, I was really, really pleased that majority of my treatment had been over. It wasn't that bad. The bed was fine. I initially thought that I'd have to go into a tube and that I'd literally be very claustrophobic. But no, it's literally just a bed and a machine moves around you, but it's an open machine. So I was absolutely fine. I didn't feel a thing through my radiotherapy. I did not feel any burning feeling or anything, which people put the fear of God in you. But technology is absolutely amazing now, and you're in and out so quick. And all the professionals, all the NHS staff that were there, they make sure you are feeling most comfortable at all times. So I had to keep my mask on, which was really strange, but I almost fell asleep on the radiotherapy bed at some point, because sometimes you're just so exhausted from getting up and going into the hospital all day. generally after radiotherapy, I did have some feeling of tiredness, but it wasn't that bad. I, I for let's say I would go into the hospital probably about 9 o'clock. Let's say my appointment time would be. For the next few hours after that, I'd be fine. I'd be able to get on with doing few little things in the kitchen and whatever. But then later on that afternoon or that evening, I would begin to feel a little bit tired. I wouldn't fall asleep necessarily, but I just felt like I just wanted to lie down. I just felt really generally just tired. No aches, no pains, just tiredness. So that tiredness still carried on for a little while actually after radiotherapy finished, after the 19 sessions. Took a couple of weeks to settle down. But yeah, it everybody kept saying to me, Jazz, you've been through chemotherapy, you've been through your surgery, radiotherapy will be a walk in the park. So it pretty much was, and that's the advice I'm going to give to people. Radiotherapy it's just so quick and easy. You just listen to them and follow their guidance, and they're professionals. They know exactly what they're doing. So now radiotherapy is over. My ongoing treatment is I'm still having the two drugs inside. They're injecting the two drugs inside. They're doing them in my thighs now because my veins in my hand just couldn't take a cannula anymore. But also medicine has now changed, and they're able to advance on the medicine and the way that they give it. So I'm now not having those two drugs via IV. I'm now having them via an injection, and that injection is given in either of my thighs. So they'll do a right leg one time and then they'll do a left leg the next time. So every 3 weeks I'm still going for that injection, and that should keep me going up until the end of this year. And then once that is done, I don't think any more treatment is planned, not that I'm aware of. But obviously in this meantime, in this whole duration, I'm still having tests done, I'm still having scans done, just so that they can keep monitoring me. I went for a mammogram last week, and yeah, if my breasts were fine, I probably wouldn't have had an issue at all. But I'm still a little bit sore after my surgery. It still hurts. I still can't sleep for a long amount of time on that right side of my body. But oh my God, this mammogram killed me. I was in pain because when she was like squashing my boob in the two plates, she couldn't get the positioning right. It just wouldn't take the scan. And she had to take me out, put me back in, take me out, put me back in 3 times, and it hurt. It really hurt. So I was quite achy for the rest of that day. So yeah, I just planned myself a nice little treat, and I felt much better the next day. But yeah, I feel a lot more full of energy, a lot more full of beans. I feel like I can do a lot more. So yeah, life is on the up again, and my hair is growing back, which is fabulous. I'm so pleased to see that I'm getting some hair back. And I've seen, since lockdown has sort of like eased off a little bit, it's been really nice. I've been seeing a few friends and some family, and we've been getting out and about. We've enjoyed the hot weather and everything that we've had. But yeah, I'm so pleased that I can finally see people, and I can finally give people hugs and actually begin to feel like I'm living life again. So yeah, great news, onwards and upwards. And again, thank you again, everybody, for your love and your support, your words of encouragement, all the prayers, all the little messages that I get. I can't thank you enough. You guys are absolutely amazing, and you've really helped me in my journey to get to where I am today. So my smiles are all for you. Thank you very much. Speak soon.